Hi, everybody. The session that I will be talking about is called Cardiovascular Disease and Rheumatoid Arthritis. Throughout this, I will be talking about the risk factors of cardiovascular disease, the different things that can happen with the medications in terms of cardiovascular disease, and strategies to reduce risk. There are traditional risk factors for cardiovascular disease that is for everybody and not just RA patients. And that includes obesity, diabetes and insulin resistance, hypertension, tobacco use, hyperlipidemia, dyslipidemia, and genes. So there are also risk factors that have to do with RA. And the first one is inflammation can accelerate the thickening and hardening of arteries. It's also called atherosclerosis, and the narrowing of the heart surface blood vessels, which is called endothelial dysfunction, and also the failure of the small blood vessels that are feeding the heart, which is called microvascular disease. So inflammation can highly accelerate all of those, which then therefore lead to cardiovascular disease. An increase in specific TNFs and interleukins can lead to aortic dysfunction. Formation of neutrophil extracellular traps, or NETs, happens in RA, and that can also increase the risk for cardiovascular disease. Citrullination, or CCP antibodies, also increase the risk for cardiovascular disease. And this thing called the lipid paradox also can be something that needs to really be looked at, which is basically the lowering of certain lipids for RA or to help treat RA can therefore increase the cardiovascular disease risk. And a few stats about RA patients and cardiovascular disease, two of them really stood out to me, which is 40% of RA deaths are due to cardiovascular disease, and patients in remission have 50% less risk for a cardiovascular event. So when the patient is flaring, much higher risk for a cardiovascular event. And certain medications can also increase the risk for cardiovascular disease, specifically NSAIDs and steroids. Naproxen seemed to be the least harmful, and diclofenac appeared to be the most damaging. And DMARDs in general can help decrease cardiovascular risk. And with JAK inhibitors, you need to really outweigh the benefits of lowering disease activity with RA and increasing the risk for cardiovascular disease. So JAK inhibitors specifically, there needs to be like a little song and dance of trying to figure out if a JAK inhibitor is even worth it or if it's going to make too much risk for cardiovascular disease. And a few things that I saw that would be important for patients to know about basically mitigating the risk or how to reduce risk. One of them is to know about the cardiovascular risk calculator. There's two. There's one called the Framingham or the SCORE. It's SCORE in capital letters. Talking to your doctors about those to see if that's something that should be used. And assess risk every 5 years. Ever since seeing the risk for cardiovascular disease every 5 years after that, making sure to reassess the risk on any changes in medication or changes in diagnoses and things like that. And of course, like always, they would recommend a healthy lifestyle, which means regular exercise, at least 150 minutes a week. The Mediterranean diet, which is lean protein, less carbs, a lot of vegetables, and smoking cessation, which is always recommended. Exercise can decrease CRP and improve microvascular and macrovascular function. I hope that this was informative for you and that you can learn something from this and apply it to your everyday life if it fits. Alrighty, have a great day. Talk to you soon. Bye-bye.